As the specter of a government shutdown approaches, concerns are mounting among Wisconsin Democrats regarding the potential loss of health care for their constituents. The last time the government teetered on the edge of a shutdown, Democratic leaders swiftly engaged in negotiations with their Republican counterparts, ultimately reaching an agreement that ensured federal agencies remained operational and essential services continued. However, that agreement is nearing its expiration, and the current political climate in Washington shows a stark lack of willingness to find common ground. In a striking move, former President Donald Trump has instructed Republicans to not even bother dealing with Democrats. This directive has led to the House passing a resolution to keep the government functioning, but it was done almost entirely along party lines, disregarding any input from Democrats. This has raised alarms among Democratic leaders who feel sidelined in the decision-making process. Wisconsin Democratic U.S. Representative Mark Pocan, a member of the House Appropriations Committee, expressed his uncertainty about the seriousness of Republican efforts to reach a resolution before the September 30th deadline. He made these comments during a press briefing in his Madison office, shortly after Trump canceled a meeting with Democratic leaders from both the House and Senate. Adding to the urgency, the House will not be in session during the critical final days of September as the countdown to a potential shutdown continues. Despite these challenges, House Minority Leader Hakeem Jeffries, Senator of Connecticut, has called the Democratic caucus back to Washington, prompting Pocan to say, "I'll be flying Monday out to Washington. Hopefully they'll decide we've got work to do. But you know, this is something where we don't run the House or the Senate or the White House." This statement underscores the sentiment that if a government shutdown occurs, the blame will largely fall on the Republicans. Conversely, Republicans seem unfazed by the prospect of a shutdown, dismissing Democratic calls to include provisions that would reverse cuts to Medicaid and extend Affordable Care Act (ACA) premium tax credits, which are set to expire at the end of the year. Without these credits, an estimated 5 million Americans could find themselves unable to afford any health insurance. The implications of a government shutdown are dire, particularly for those who rely on government services, and it could have a ripple effect on the broader economy. Pocan highlighted the urgency of the situation, stating, "But at the same time, we're trying to fight for people who lost their health care and other things from what we call the big ugly law." He referenced data from the nonpartisan health research organization KFF, which indicates that if the ACA tax credits are not extended, health insurance premiums in Wisconsin could see significant increases. For instance, a family of 4 earning $130,000 annually could face a staggering rise in premiums, potentially amounting to $1,588 per month, or $19,081 per year. Nationally, KFF projects that premiums could surge by over 75% if these credits are allowed to lapse. In response to this looming crisis, Wisconsin Senator Tammy Baldwin has advocated for legislation she introduced earlier this year, which aims to make the enhanced premium tax credits permanent. She is urging that this measure be included in any stopgap funding bill to prevent a government shutdown. In a joint statement, Democratic leaders from both the House and Senate criticized their Republican colleagues for neglecting to address the urgent issue of expiring ACA tax credits. They pointed out that at a time when families are already being squeezed by higher costs, Republicans refuse to stop Americans from facing double-digit hikes in their health insurance premiums. The potential spike in health insurance costs, coupled with rising consumer prices due to Trump's tariffs, could significantly impact voters just before the midterm elections, which will occur shortly after the ACA tax credits are set to expire. One would think that the political ramifications alone would motivate action to prevent such a drastic increase. However, the current Republican Party seems to be operating under a different set of priorities. Many members of Congress who previously supported the Big Beautiful Bill Act that aimed to cut health care, food assistance, and federal services appear to be in lockstep with Trump, seemingly indifferent to the consequences of a government shutdown. While a shutdown would undoubtedly create challenges, Pocan emphasized that his greater concern lies in the harm already inflicted on the American people. He stated, "I'm far more concerned about what they just did to people that we need to try to fix. And if they're not willing to have those conversations with us, that's a big problem." As we navigate this complex political landscape, it's crucial to consider the broader implications of these decisions. What do you think? Are the Republicans truly ignoring the needs of the American people, or is there more to this story? Share your thoughts in the comments.